Hello, students! Are you ready to tackle the 30 most important NCLEX questions? Join us in this video to boost your exam confidence and ace the test. All right, class, let's dive into our first question. A nurse is monitoring a 60-year-old male patient with a history of coronary artery disease. He's currently in the ICU post-myocardial infarction and on IV lidocaine for persistent ventricular arrhythmias. What is the primary consideration for the nurse in relation to this medication? Here are the options for this condition. A. Decreased oxygen saturation. B. Elevated blood pressure. C. Presence of PVCs on ECG. D. Increased intracranial pressure. Before solving this question, it is important to understand that it is based on priority. While more than one option may be correct, you need to select the action with the highest priority. We're dealing with a patient in the ICU post-myocardial infarction, which means he's had a heart attack, and he's on IV lidocaine. The key here is understanding what we need to watch for with lidocaine. Decreased oxygen saturation. While important, it's not the primary concern with lidocaine. This option is incorrect. Elevated blood pressure, also important but not directly related to lidocaine. This option is not right. Presence of PVCs on ECG. This is crucial because lidocaine is given to manage ventricular arrhythmias, such as PVCs. So this option is correct. Increased intracranial pressure, not directly related to lidocaine. This option is incorrect. So our correct answer will be option C, presence of PVCs on ECG. In the context of acute myocardial infarction, managing life-threatening arrhythmias is the priority. Lidocaine is specifically indicated for treating ventricular arrhythmias, such as PVCs, which can signal an increased risk for more serious arrhythmias, like ventricular tachycardia or ventricular fibrillation. Monitoring the presence of PVCs on a cardiac monitor is crucial for determining the effectiveness and necessity of lidocaine administration. Other factors, while important, do not directly indicate the need for lidocaine in this scenario. Great job! Now let's move on to our next NCLEX question. A 65-year-old male with atrial fibrillation and controlled hypertension, now on warfarin therapy, also has a history of peptic ulcers. What discharge instruction is most critical for the nurse to provide? Here are the options for this condition. A. Report incidents of diarrhea. B. Avoid foods high in vitamin K-C. Use a straight razor for shaving. D. Take aspirin for pain relief. Let's break this down. Our patient is on warfarin, which is an anticoagulant, and he has a history of peptic ulcers. Warfarin requires careful management to prevent complications. Report incidents of diarrhea. Important, as it can affect medication absorption, but not the top priority. This option is incorrect. Avoid foods high in vitamin K. This is key because vitamin K can counteract the effects of warfarin. So this option is correct. Use a straight razor for shaving. Not ideal, but less critical. This option is not right. Take aspirin for pain relief. This is actually contraindicated. This option is incorrect. The correct answer is B. Avoid foods high in vitamin K. Patients taking warfarin should maintain a consistent intake of vitamin K because it is crucial for the clotting process. Warfarin works by inhibiting vitamin K, reducing the blood's ability to clot. Sudden increases in vitamin K intake can decrease warfarin's effectiveness and increase the risk of clot formation. Reporting diarrhea is also important as it can affect medication absorption, but avoiding vitamin K-rich foods directly impacts the effectiveness of the anticoagulant therapy and is the priority instruction. Excellent! Let's tackle the next question. In a surgical unit, a nurse needs to insert an IV catheter for a 30-year-old patient scheduled for surgery who has a hairy forearm and a history of adhesive allergies. How should the nurse manage the excess hair at the insertion site? Here are the options for this condition. A. Leaving the hair intact. B. Shaving the area. C. Clipping the hair. D. Removing hair with a depilatory, this situation involves preparing a surgical site while considering the patient's skin sensitivity and adhesive allergies. Leaving the hair intact, not ideal as it can interfere with the IV securement. This option is incorrect. Shaving the area can cause microabrasions and increase infection risk. This option is not suitable. Clipping the hair, the safest option to minimize infection risk. So, this option is correct. Removing hair with a depilatory, not suitable due to potential skin reactions. This option is incorrect. The correct answer is C, clipping the hair. Clipping the hair is preferred over shaving because it minimizes the risk of creating microabrasions, which can increase the risk of infection, especially important for a patient with sensitive skin. Using chemical depilatories is not recommended due to the patient's adhesive allergies and sensitive skin. Leaving the hair intact could interfere with the securement of the IV catheter and increase infection risk. All right, students, let's move on to our next question. A 60-year-old patient has just had cataract removal with an intraocular lens implant and expresses anxiety about recovery. What discharge instruction should the nurse prioritize to avoid increasing ocular pressure? Here are the options for this condition. A. Restrict fluids to limit urination. B. Avoid lifting heavy objects. C. Remain prone while resting. D. Avoid straining during bowel movements. After cataract surgery, it's essential to avoid activities that can increase intraocular pressure. Let's find out which instruction is most critical. Restrict fluids to limit urination. Not related to ocular pressure. This option is incorrect. Avoid lifting heavy objects. Important, but secondary. This option is not the primary action. Remain prone while resting. Not relevant to ocular pressure. This option is incorrect. Avoid straining during bowel movements. This is crucial to prevent pressure increase. So, this option is correct. The correct answer is D. Avoid straining during bowel movements. After cataract surgery, avoiding activities that can increase intraocular pressure is critical. Straining during bowel movements and bending at the waist can significantly increase intraocular pressure, risking the surgical site and newly placed intraocular lens. Restricting fluids, remaining prone, and keeping living spaces dimly lit do not directly address the issue of intraocular pressure. All right, class, let's explore our next question. A 20-year-old individual attending a health education session with a family history of testicular cancer is seeking information on risk reduction. When should the nurse emphasize the initiation of regular testicular self-examinations? Here are the options for this condition. A. At the onset of sexual activity. B. After the age of 69C, starting after age 40D. Prior to age 20, testicular self-examinations, TSE, are important for early detection of testicular cancer. Let's determine the best time to start regular TSE. At the onset of sexual activity, not relevant to testicular cancer risk. This option is incorrect. After the age of 69, too late, as testicular cancer is more common in younger men. This option is not suitable. Starting after age 40, also too late. This option is incorrect. Prior to age 20, correct, as this is when testicular cancer is most common. So, this option is correct. The correct answer is D, prior to age 20. Regular testicular self-examinations should begin before age 20, as testicular cancer most commonly occurs between ages 20 and 30. Early detection through self-examination can lead to prompt medical intervention, especially important given the family history. Starting at the onset of sexual activity, after age 69, or during annual exams does not align with the peak incidence period for testicular cancer. Great job! Now, let's move on to our next NCLEX question. A 55-year-old male patient post-colon resection suddenly experiences wound dehiscence and evisceration. What is the nurse's immediate priority? Here are the options for this condition. A. Notify the surgeon. B. Cover the eviscerated tissue with a saline-moistened dressing. C. Check vital signs. D. Approximate the wound edges. Here, the immediate action is asked, so more than one option can be right, but we have to choose the immediate action. Wound dehiscence and evisceration are serious complications. Let's find out the immediate priority for the nurse. Notify the surgeon. Important, but not the first action. This option is not right. Cover the eviscerated tissue with a saline-moistened dressing. This is crucial to protect the tissue, so this option is correct. Check vital signs. Necessary, but secondary. This option is incorrect. Approximate the wound edges. Not appropriate in this situation. This option is incorrect. The correct answer is B. Cover the eviscerated tissue with a saline-moistened dressing. Covering the eviscerated tissue with a sterile dressing moistened with normal saline is crucial to maintain the viability of the exposed organs and prevent further contamination and infection. This immediate action stabilizes the situation, allowing time for further interventions like notifying the surgeon, checking vital signs, and preparing for surgery. Approximating the wound edges or administering pain medication should only be done under a physician's guidance. Let's move on to our next question. A 76-year-old male patient with extensive brain damage post-stroke exhibits a breathing pattern with cycles of increasing and decreasing depth and rate, culminating in apnea. What does this pattern most likely indicate? Here are the options for this condition. A. Progressively deeper breaths, followed by shallower breaths with apneic periods. B. Rapid, deep breathing with abrupt pauses. C. Rapid, deep breathing and irregular without pauses. D. Shallow breathing with increased respiratory rate. Breathing patterns can indicate underlying neurological issues. Let's see what this specific pattern suggests. Progressively deeper breaths followed by shallower breaths with apneic periods describes Cheyne-Stokes respirations, often seen in brain damage. So, this option is correct. Rapid, deep breathing with abrupt pauses, not typical of Cheyne-Stokes. This option is incorrect. Rapid, deep breathing and irregular without pauses. Describes Kussmaul's respirations seen in metabolic acidosis. This option is not right. Shallow breathing with increased respiratory rate. Describes tachypnea, not Cheyne-Stokes. This option is incorrect. The correct answer is A. Progressively deeper breaths followed by shallower breaths with apneic periods. This breathing pattern describes Cheyne-Stokes respirations, often seen in patients with brain damage affecting the respiratory centers. It involves cycles of progressively deeper breaths, followed by shallower breaths and periods of apnea. Biot's respirations, Kussmaul's respirations, and tachypnea present differently and do not match this description. Now, let's move on to our next NCLEX question. A nurse evaluates a female patient with worsening heart failure who presents with shortness of breath and a cough that worsens when lying down. What breath sounds is the nurse most likely to hear? Here are the options for this condition. A. Tracheal. B. Fine crackles. C. Coarse crackles. D. Friction rubs heart failure can lead to specific lung sounds due to fluid accumulation. Let's determine which sound is most likely. Tracheal. Not associated with heart failure. This option is incorrect. Fine crackles. Typically heard with pulmonary edema in heart failure. So this option is correct. Coarse crackles. Possible but less specific. This option is not right. Friction rubs. Associated with pericarditis. This option is incorrect. The correct answer is B. Fine crackles. Fine crackles are typically associated with fluid accumulation in the air spaces of the lungs, common in heart failure. They are created by the opening of small airways and alveoli compromised by fluid. Other breath sounds like tracheal, coarse crackles, friction rubs, wheezes, stridor, and pleural knocks are not as indicative of heart failure-related pulmonary fluid buildup. Let's explore our next question. A 30-year-old asthma patient in the ED suddenly has no audible wheezing after initially wheezing loudly. The patient is anxious and using accessory muscles to breathe. What does this change most likely indicate? Here are the options for this condition. A. The asthma attack has resolved. B. The airways are so constricted that air cannot pass through. C. The inflammation has subsided. D. Fine crackles have replaced the wheezes. A sudden absence of wheezing in an asthma patient can be alarming. Let's determine what this might indicate. The asthma attack has resolved, unlikely given the use of accessory muscles. This option is not right. The airways are so constricted that air cannot pass through, indicates a severe, life-threatening asthma attack. So, this option is correct. The inflammation has subsided. Wouldn't explain the accessory muscle use. This option is incorrect. Fine crackles have replaced the wheezes. Not typical in this scenario. This option is incorrect. The correct answer is B. The airways are so constricted that air cannot pass through. The absence of wheezing indicates that the airway constriction has worsened to a critical level, resulting in a silent chest. This is a sign of a severe, life-threatening asthma attack, requiring immediate intervention to open the airways and restore adequate ventilation. Other options do not explain the sudden absence of breath sounds. Now let's move on to our next NCLEX question. During a tonic-clonic seizure, which actions should a nurse take to ensure the patient's safety? Select all that apply. Here are the options for this condition. A. Place the patient on their back and insert a padded tongue depressor. B. Place the patient in a lateral position and remove hazardous objects. C. Position the patient supine and restrain their limbs gently. D. Turn the patient to a side-lying position and protect the head. Seizure management focuses on ensuring the patient's safety. Let's identify the appropriate actions. Place the patient on their back and insert a padded tongue depressor. Not recommended due to the risk of injury. This option is incorrect. Place the patient in a lateral position and remove hazardous objects. Correct to prevent aspiration and injury. So, this option is correct. Position the patient supine and restrain their limbs gently. Not recommended. This option is not suitable. Turn the patient to a side-lying position and protect the head. Correct to prevent aspiration and injury. So, this option is correct. The correct answers are B and D. Placing the patient in a lateral position helps maintain an open airway and allows oral secretions to drain, preventing aspiration. Removing hazardous objects minimizes injury risk, and protecting the head prevents trauma during convulsive movements. Inserting anything into the mouth is not recommended due to injury risk, and restraining limbs or positioning the patient prone is inappropriate. Now, let's move on to our next NCLEX question. During an assessment, what information should a nurse prioritize for an 85-year-old female patient admitted with chronic hypertension and mild cognitive impairment? Here are the options for this condition. A. General health overview from the past decade. B. Current health promotion activities. C. Family history of chronic diseases. D. Marital status and living arrangements. Assessing a patient with chronic hypertension and mild cognitive impairment involves understanding their current health status and activities. Let's prioritize the information. General health overview from the past decade. Important, but too broad. This option is incorrect. Current health promotion activities. Crucial to understand their engagement in maintaining health. So this option is correct. Family history of chronic diseases. Important, but secondary. This option is not right. Marital status and living arrangements. Relevant but less critical. This option is incorrect. The correct answer is B, current health promotion activities. Understanding the patient's current engagement in health promotion activities, such as diet and exercise, provides insight into their level of engagement in maintaining or improving their health. This information helps tailor the care plan to support or enhance these activities, which is particularly important given the patient's chronic conditions and recent diabetes diagnosis. Other information is also important, but secondary to understanding current health practices. All right, class, let's explore our next question. How should a nurse minimize the risk of aspiration when providing oral care to a comatose 76-year-old female patient with COPD? Here are the options for this condition. A. Apply lemon glycerin swabs frequently. B. Brush the teeth with the patient lying flat. C. Position the patient side-lying and lower the bed. Head. D. Use hydrogen peroxide for cleansing aspiration is a serious risk in comatose patients. Let's determine the best way to minimize this risk during oral care. Apply lemon glycerin swabs frequently. Not recommended due to potential irritation. This option is incorrect. Brush the teeth with the patient lying flat. Increases aspiration risk. This option is not suitable. Position the patient side-lying and lower the bed head. Correct to allow drainage and prevent aspiration. So, this option is correct. Use hydrogen peroxide for cleansing. Not ideal due to potential irritation. This option is incorrect. The correct answer is C. Position the patient side-lying and lower the bed head. Placing the patient in a side-lying position with the head of the bed lowered allows for drainage of oral secretions, reducing the risk of aspiration. Using lemon glycerin or hydrogen peroxide can dry out or irritate the mucous membranes. Brushing the teeth with the patient lying flat increases aspiration risk. A suction toothbrush and moistening the oral mucosa are helpful, but not as critical as positioning to prevent aspiration. Now, let's move on to our next NCLEX question. A 70-year-old male patient with dehydration and mental status changes develops a fever, cough with yellow sputum, and pleuritic chest pain. What condition is likely? Here are the options for this condition. A. RDS. B. Myocardial infarction. C. Pneumonia. D. Tuberculosis. These symptoms point to a specific condition. Let's identify it. ARDS. Presents with dyspnea and worsening hypoxia. Not typical here. This option is incorrect. Myocardial infarction. Presents with constant chest pain, not typically with fever and productive cough. This option is not right. Pneumonia. Fever, productive cough, and pleuritic chest pain are classic signs. So, this option is correct. Tuberculosis. Presence with a cough producing blood-tinged sputum, not typical here. This option is incorrect. The correct answer is C. Pneumonia. Fever, productive cough, and pleuritic chest pain are common signs of pneumonia, particularly given the patient's dehydration and change in mental status. ARDS presents with dyspnea and worsening hypoxia, Michigan with constant chest pain, and TB with a cough producing blood-tinged sputum. Pneumonia is the most likely diagnosis based on the symptoms described. Let's explore our next question. In the context of a TB outbreak, which client should be prioritized for TB screening? Here are the options for this condition. A. 15-year-old with mild cough and fatigue. B. 30-year-old daycare worker with persistent cough and recent travel history. C. 40-year-old homeless man with alcohol use disorder and coughing up blood. D. 54-year-old businessman with unexplained weight loss and a cough TB screening should focus on those at highest risk. Let's identify who should be prioritized. 15-year-old with mild cough and fatigue, low risk. This option is incorrect. 30-year-old daycare worker with persistent cough and recent travel history, moderate risk. This option is not suitable. 40-year-old homeless man with alcohol use disorder and coughing up blood, high risk due to multiple factors. So, this option is correct. 54-year-old businessman with unexplained weight loss and a cough, moderate risk. This option is incorrect. The correct answer is C, 40-year-old homeless man with alcohol use disorder and coughing up blood. Tuberculosis is more prevalent in populations with certain risk factors, including homelessness and substance abuse. A homeless individual with a history of alcoholism and hemoptysis has a higher risk of TB exposure and a weakened immune system, making TB screening a priority. Other options have relevant risk factors, but the combination of homelessness, substance abuse, and hemoptysis is the most indicative. Great job! Now let's move on to our next NCLEX question. A 40-year-old patient with a positive MAN2 test reports a productive cough and night sweats. Why is a chest X-ray most crucial? Here are the options for this condition. A. Confirm active TBB. Determine need for repeat MAN2 test C. Assess lesion size and spread D. Differentiate primary from latent TB infection. A positive MAN2 test and these symptoms suggest TB. Let's see why a chest X-ray is crucial. Confirm active TB. A chest X-ray helps, but sputum culture confirms diagnosis. This option is not right. Determine need for repeat MAN2 test, not the main reason. This option is incorrect. Assess lesion size and spread correct, as it shows the extent of infection. So, this option is correct. Differentiate primary from latent TB infection. Also important, but secondary. This option is incorrect. The correct answer is C, assess lesion size and spread. A chest X-ray is essential to determine the extent of lesions in the lungs. While sputum culture confirms the diagnosis, the X-ray shows the lesion's presence and size. False positive or false negative MAN2 tests and differentiating primary from latent TB require different diagnostic methods. The X-ray helps assess the spread of the infection. All right, students, let's explore our next question. A 30-year-old asthma patient with difficulty breathing, wheezes, and a reduced peak expiratory flow rate is experiencing an exacerbation. Which medication should be administered first? Here are the options for this condition. A. Beta-adrenergic blockers. B. Bronchodilators. C. Inhaled steroids. D. Oral steroids. Asthma exacerbations require quick intervention. Let's identify the first medication to administer. Beta-adrenergic blockers, contraindicated in asthma. This option is incorrect. Bronchodilators, correct for immediate relief. So, this option is correct. Inhaled steroids, used for long-term management. This option is not right. Oral steroids, also for long-term management. This option is incorrect. The correct answer is B, bronchodilators. For acute asthma exacerbations, the immediate goal is to open the airways and relieve constriction. Bronchodilators, such as short-acting beta agonists, act quickly to dilate the bronchi and bronchioles, increasing airflow. Other medications like inhaled or oral steroids and anticholinergics are used for long-term management and not as immediate relief in acute settings. Let's move on to our next question. A 50-year-old patient with a persistent cough, thick sputum, lower extremity swelling, and cyanotic nail beds has a long history of smoking. What condition is likely? Here are the options for this condition. A. ARDS. B. Asthma. C. Chronic obstructive bronchitis. D. Emphysema. These symptoms suggest a chronic lung condition related to smoking. Let's determine which one. ARDS. Acute and presents differently. This option is incorrect. Asthma. Presence with reversible airway obstruction. This option is not right. Chronic obstructive bronchitis. chronic cough with thick sputum and cyanosis fits. So, this option is correct. Emphysema presents with pink puffer symptoms. This option is incorrect. The correct answer is C, chronic obstructive bronchitis. Chronic cough with thick sputum, peripheral edema, and cyanotic nail beds, combined with a significant smoking history, suggests chronic obstructive bronchitis, a type of TOPD. Symptoms like these are typical for chronic bronchitis and less indicative of conditions like ARDS, asthma, emphysema, pulmonary hypertension, or lung cancer. Let's move on to our next NCLEX question. A 55-year-old patient post-embolectomy for arterial occlusion has no detectable pulses in the left foot 6 hours after the procedure and refuses further surgery. What should the nurse prioritize? Here are the options for this condition. A. Explain the risks of refusing surgery. B. Notify the physician immediately. C. Notify the nursing supervisor. D. Record the client's refusal in the nurse's notes. A patient's refusal of critical surgery needs to be addressed carefully. Let's prioritize the nurse's actions. Explain the risks of refusing surgery. Correct to ensure informed decision. So, this option is correct. Notify the physician immediately. Follows patient education. This option is not right. Notify the nursing supervisor. Secondary. This option is incorrect. Record the client's refusal in the nurse's notes. Necessary, but after education. This option is not suitable. The correct answer is A. Explain the risks of refusing surgery. The nurse's initial response should be to explain the risks of not having the surgery to ensure the patient makes an informed decision. If the patient still refuses, the nurse should then notify the physician and document the refusal. Notifying the supervisor or documenting refusal without discussing the risks does not prioritize patient education and informed consent. All right, students, let's move on to our next question. During shift change, which client should the on-duty nurse assess first? Here are the options for this condition. A. 56-year-old with heart failure, BP 124/74 mmHg, RR 23B, 90-year-old with end-stage right-sided heart failure, BP 77/50 mmHg, and DNRC, 60-year-old with thrombophlebitis on IV heparin D, 78-year-old with new-onset atrial fibrillation on IV diltiazem shift change assessments should prioritize clients with the greatest potential for instability. Let's identify who should be assessed first. 56-year-old with heart failure, BP 124/74 mmHg, RR 23, stable. This option is incorrect. 90-year-old with end-stage right-sided heart failure, BP 77/50 mmHg, and DNR, stable with DNR order. This option is not right. 60-year-old with thrombophlebitis on IV heparin, requires monitoring but less urgent. This option is incorrect. 78-year-old with new-onset atrial fibrillation on IV diltiazem, greatest potential for instability. So, this option is correct. The correct answer is D. 78-year-old with new-onset atrial fibrillation on IV diltiazem. The client with new-onset atrial fibrillation and receiving IV diltiazem has the greatest potential for instability and requires close monitoring. The other clients, while requiring care, are more stable or have a DNR order, indicating a lower immediate priority for assessment.